What to know about COVID-19 antibody testing with Sharon Alfonsi.
If you decide to get an antibody test, you have to be responsible for knowing that that test cannot yet safely lead you to modify your behavior.
Testing for COVID.
This week on 60 Minutes, our story is about antibody testing. And we were investigating for about 3 months, trying to determine whether these antibody tests really worked and whether the promise of antibody testing, what it was sold as, which was kind of this wonderful way to give us a passport back into kind of opening the economy, whether that was actually the case or not.
Tonight, there is growing concern over reports that thousands of Americans may have been exposed to the coronavirus but have not been tested. That's because of a shortage of those test kits.
So if you remember in March, there was a real problem, a real shortage of tests for COVID-19, the virology test. And then all of a sudden, there was this promise of the second test, the antibody or serology test.
If someone goes and gets a nose or throat swab, that's looking to see if the virus itself is present. That's an early diagnostic test.
We interviewed Dr. Alex Markson from UCSF. He is the director of the Institute for Genomic Immunology.
The antibody tests tell us if a person has responded to the virus. The antibody tests come up later. Together, the two different types of tests give us complementary information about the pandemic. That one tells us about who's actively infected, the other tells us who has been infected.
I think a lot of people think if they get this antibody test and they test positive, that they are going to have a shield that allows them to enter into the workforce, to go to the grocery store without their mask on. Is that what a positive antibody test means?
I think we cannot safely say that to people yet. We need more scientific data to tell people exactly the characteristics of what protection will look like, if at all.
Antibody tests are really confusing. It's not as simple as most medical tests, like a pregnancy test where you get a positive or negative and you move forward.
We'll take a look.
These tests require that even if you get a positive result or even if you get a negative result, that you then go and take another test and perhaps even another test, because the tests are just not there yet.
If you simply test your blood right after a viral exposure, you're likely to be antibody negative. It takes time for the immune system to develop a response, typically a week or more after symptom onset or the beginning of your illness. And so
We interviewed Dr. Patrick Sue, who's an assistant professor of bioengineering at UCal Berkeley.
I think when you ever get a positive test, it's important to undergo confirmatory testing, whether with a different antibody test or an independent test that looks for a different viral antigen or a different antibody isotype. So this will be a way that we can guard against false positives. The statistical likelihood that you would test false positive twice is generally quite unlikely if you use independent tests.
If you take an antibody test and you get a false positive, what does that mean?
So a false positive test means that you aren't actually positive, so you don't actually have antibodies against the virus.
One of the things the doctors suggested is you can ask the clinic or hospital that's giving you the antibody test, what is the test? And now there is a list on the FDA website, tests that they consider to be better. And so you can kind of check them because not all tests are created equally.
I think a lot of people right now are going to their doctors and they're just saying, I want the antibody test. They don't know the difference between them. What would you say just to the general public about these tests?
There are different types. There are these rapid tests, which are like at-home pregnancy tests. They're quick, they're fast, they're cheap, and then there are these laboratory tests where you need to go in and get a blood draw, and then they run your test in a lab. You're going to basically trade off different things, speed and convenience versus really exquisite accuracy.
I think it's best to think of these as research tools that are being used to track where this virus has been, who has been infected, but not yet for clinical tools to tell us something that's predictive of how someone will do.
But what would you say to people seeking out answers in these tests? Are the results reliable?
I will say that the best tests, especially tests where blood samples are being sent off to labs, seem to have reasonable test performance characteristics. Does that mean that they're perfect? No.
I think the biggest thing that I learned in this story is I was under the impression that if you had COVID-19, you had the antibodies and you were somehow safe or immune. The science isn't there yet.
I think it's important to note that a positive antibody test does not necessarily mean that you have protective immunity. It could mean that, and certainly will in some cases, but the degree to which you're protected from the virus and the length that immunity will last for is not yet known.